Have you ever wondered how you may escape the pain and hardship of renal dialysis? If so, you're not alone. According to a recent report by the World Health Organization, millions of people are at danger of renal failure. But the good news is there are effective ways to prevent it. In this video, we're going to discuss with you 5 proven strategies to maintain your kidneys healthy and avoid the need for dialysis. Some of them have been found to offer stage 5 patients up to 4 years without dialysis. Imagine a life where you don't have to worry about kidney health. By following these easy tips, you can greatly minimize your risk of kidney disease and enjoy a healthier, more active life. We'll cover everything from food and hydration to lifestyle modifications and frequent checkups, hitting you with concrete information that genuinely makes a difference. Stay with us till the conclusion of this video, and you'll learn how easy it may be to take control of your kidney health. You'll find practical strategies that you can start taking immediately to guarantee your kidneys stay in good form. So, don't miss out. Watch till the finish and empower yourself with the information to preserve your kidneys for life. Number 1. Maximal Conservative Management. Maximal Conservative Management, MCM, often known as non-dialytic treatment, is an alternative for some patients. Let me tell you about 77-year-old Mrs. Smith, who selected NCM for her chronic kidney condition. She has heart problems and underwent bypass surgery. Her renal illness diagnosis occurred 10 years ago, and in 2016, she was set to start dialysis as her condition worsened. However, she took a different course. Her daughter commented, "It's been a year since my mom started conservative care, and her condition is still stable. If she had chosen hemodialysis, it would have required another surgery to reduce the strain on her heart, which her aged body just couldn't bear." Choosing non-dialytic care is more frequent than you would assume. Today, there are clinics that specialize in this therapy. So what exactly does MCM involve? Typically, conservative care is for patients with a shorter life expectancy, although that's not always the case. The major goal is to manage health issues induced by kidney failure, such as anemia and symptoms like nausea and exhaustion, while preserving kidney function as long as feasible. The treatment often includes diuretics and antihypertensive drugs. A decade ago, this could have looked like a grim choice, but some doctors have managed to provide their patients with years free from dialysis, enjoying an excellent quality of life. Number 2. Activated charcoal. Activated charcoal is a great home cure that's proven to be a potent detoxifier, especially for stage 5 CKD sufferers. Activated charcoal has acquired appeal as a detoxifier. People use it in tiny dosages for everyday concerns including bloating, gas, and diarrhea. It's even used for whitening teeth. In emergency departments, doctors rely on it to treat overdoses and poisoning. Its power lies in its capacity to attach to toxins in the digestive system and eliminate them. A study examined 9 stage 5 CKD patients who elected not to start dialysis. Instead, patients were treated with 30 grams of activated charcoal daily along with non-dialytic treatment for 10 months. The results were amazing. Their kidney function didn't just steady, it improved. All patients experienced significant improvements in blood urea and creatinine levels. This study, published in a respectable peer-reviewed journal, gives enormous promise. What is activated charcoal so good for kidney health? This thin, black powder excels at eliminating uremic toxins, urea-derived toxins, and phosphorus. Uremia, an excess of uremic toxins, produces several symptoms in stage 4 and 5 kidney disease, include itching, swelling, problems breathing, and nausea. By helping to remove these poisons, activated charcoal can greatly alleviate the kidney strain. Several animal studies show that activated charcoal can reduce serum phosphorus, urea, and creatinine levels safely with little negative effects. It's even showed promise in stage 3 and 4 CKD patients with hyperphosphatemia, reducing phosphorus levels when taken with food. In short, activated charcoal is extraordinarily powerful at eliminating excess uremic toxins and could be a game changer for kidney health. Number 3. Very low protein diet. The greatest method to protect your kidneys and avoid dialysis is to prevent those poisons from entering your body in the first place. How can you do this? Through a very low protein diet via LPD. The VLP is typically used for treating advanced stage, pre-dialysis kidney disease, but it's especially effective for individuals who want to avoid dialysis totally. This diet was a major aspect of the treatment for the 9-stage 5 CKD patients who lived for 10 months without dialysis thanks to activated charcoal. One key advantage of the VLP over other treatments is its extensive use. Unlike some newer treatments, the VLPD has been tried and tested on thousands of CKD patients. Although it's not particularly prevalent in many parts of the world, including the US, it's exhibiting excellent results when it is utilized, such as in Italy. In fact, I've seen folks who have maintained stage 4 kidney function for 20 years without any deterioration, which is astounding. I'm not the only one who believes in the usefulness of the VLPD. A major evaluation of research including 2,996 participants indicated that very low-protein diets reduced the number of people with CKD stage 4 or 5 who progressed to end-stage kidney disease. This suggests that approximately 30,000 persons following the VLPD had a decreased likelihood of needing dialysis. The premise behind the VLPD is straightforward. The kidneys are harmed by protein. By dramatically lowering protein intake, renal function can improve. While this sounds straightforward on paper, it's not something you can perform on your own. A very low-protein diet demands accurate calculations and particular supplementation. I've made an entire video on this issue, which you can see if you're interested. Also, I'd love to hear from those of you already following any kind of low-protein diet, whether vegan, plant-based, or otherwise. Let me know if you'd be interested in a video explaining what works and what doesn't in these diets. I'm planning to develop additional information on low-protein diets and want to see how much interest there is. Number 4. Gum arabic. Another detoxifier that's even more potent than activated charcoal is gum arabic, also known as the gum from the acacia tree. It is a soluble dietary fiber that functions like a brush in the colon, eliminating waste and toxins. You might find it in common things from candy to cosmetics. As a remedy, research suggests it can help with diabetes, high cholesterol, weight loss, and high blood pressure. Here's the genuinely exciting part. Gum arabic has been utilized to prevent dialysis totally for an 11-year-old child with absolutely little renal function. According to a study, she lived 4 years free from dialysis, enjoyed good health, participated in outdoor activities, and never developed acidosis or major uremic symptoms. This makes gum arabic the most potent kidney detoxifier known. The girl was also treated with other medications to support her renal function, including the VLPD we talked about before. While gum arabic is a generally available and economical home remedy, it's not yet an approved treatment for stage 5 kidney disease. However, its astonishing performance has inspired more investigation. A recent study, published in the Journal of Functional Foods only last week, evaluated gum arabic's kidney-protecting capabilities in stage 3 and 4 CKD patients. These individuals had their normal diet supplemented with 25 grams of gum arabic every day for 12 months. The results were amazing. Typically, a patient's GFR, a measure of renal function, is expected to deteriorate steadily in these stages. Instead, the GFR participants in this trial increased within just 3 months. Even more amazing, a year after the treatment ended, their GFR continued to climb. Researchers believe these effects are related to gum arabic's anti-inflammatory and antioxidant characteristics. While additional research is needed before this becomes an approved medication, these findings are highly promising. Number 5. Paired Kidney Exchange Program. Let me tell you about the Paired Kidney Exchange Program, a superb technique to discover a matching kidney donor when a direct match isn't possible. Imagine you need a kidney, and you're fortunate enough to have a willing donor, a relative, spouse, or acquaintance. However, compatibility is crucial. The donor must have a compatible blood type and pass tissue typing testing to confirm the match is suitable. If either criteria fails, a direct gift isn't feasible, which can be upsetting. This is where the Paired Kidney Exchange Program comes in. If you and your donor aren't compatible, you can join the program and be connected with another incompatible donor/recipient couple. Essentially, your donor will give their kidney to a recipient in the other pair, while you receive a kidney from that recipient's donor. This swap can involve numerous pairings, creating a chain of donations that supports several people at once. If you're interested in this program, contact your transplant hospital or a transplant hospital that provides an exchange program. They can provide the guidance and assistance you need to negotiate this life-changing opportunity. Thank you for watching our video on alternatives to dialysis. We hope you found these options helpful and inspiring. Have you or a loved one attempted any alternative remedies for kidney disease? Share your experiences in the comments below.